So then we go to reduce toxicity and support detoxification. Now that's a huge thing. We get so many toxins as we around our day, products that we're using, the environment we live in, even metabolism creates toxins in our body. So how do we support our body through that reduced toxicity and support detoxification?
Ditch and switch.
Yeah.
Get rid of the things that you're putting on your skin that you're absorbing. I mean, transdermal, that's what we all love the oils for, is that they can absorb transdermally, and everything that we're exposed to has that potential to get systemically into your system and basically cause damage. So a lot of products that we don't realize have toxins, right? And I'm going to talk more about toxins and what is that and how's that defined. But anything that really puts stress on the body, we could consider a toxin. Let's control what we can and get rid of the things that we don't have to be putting on the skin, because we do know over 60% of what we put on the skin can be absorbed and actually have systemic implications, especially cumulative and long term. For example, nowadays you'll see things really brag if they don't have parabens, phthalates, things that, we've never even noticed. They're the last word on the bottle. And by the way, it's not a well-known fact that the ingredients don't have to be listed in order of how much there is in there.
Yeah.
So they can put it in just about any order, and we really don't know how much of any of that is in there. But those types of preservatives that have been around for a long time, we're now finding that may have implications and have endocrine disrupting properties, mimicking female type hormones, specifically parabens. And we're seeing systemic absorption of sunscreens. It almost sounds like blasphemy for a dermatologist to bring up the implications of wearing a sunscreen, but we absolutely are finding, even in lower level application, serum levels that are showing we are absorbing those chemicals that are coming from the sunscreen.
Yeah.
And so we have to take that and say, okay, if that's just one thing we're measuring, everything we're putting on the skin has potential to get in there and cause a potential toxicity over time.
I remember one day I was working with my lawnmower, right? And as I was working with my lawnmower, it was summertime, actually, beautiful day similar to this. And as I was working with my lawnmower, I had a little bit of a gasoline leak, and it got all over my hand. Finished the job, did whatever, went inside, and about an hour later, I became really sick, was not feeling well at all.
Yeah.
And was trying to figure out why all of a sudden I wasn't feeling well. It's because my skin had absorbed so many of those horrible chemicals, and we do that with lots of things that we intentionally put on our body every day that we're not aware can cause problems like this, and then we become challenged, right?
And I think we're just beginning to really start to put specific correlations in there, but what we don't know, and so why not use the cleanest, best products that we can, so that 50 years down the road, we're not saying, oh, I used to use that all the time when I was younger.
Right.
Because we are now educated. And I feel like the general public is educated. We want to be healthy in our skin, our body, everything. It's a reflection of and really represents who we are and what we're going to put out in the world. And I feel like using those clean products, it's not just going to make us look good, but it's also going to make us feel good, and we're going to present our best self. And knowing that there is that potential for those unknown things that you can't pronounce.
Yeah.
We don't really know exactly what they do. When you have products that are available that do give you an option, which we may not have had 20, 30, 40, 50 years ago when my parents told me they were putting sunscreen on me, and it was really SPF 2 oil, which I said, you're actually cooking me at the time. It was not sunscreen.
It was basting you.
Yeah, you were
rather than preventing sun damage.
We don't have as many excuses, right? If you've got the other option, why, if you have two options, would you not pick the one that we know is clean and that has the less risk?
Yeah, and I think this has really come from a grassroots movement of patients and the public demanding better things, rather than, unfortunately, where it should have come from is the healthcare system saying, we know better, we should start doing better. But now, we have patients coming to us saying, what are the better options? We weren't trained in this, but we now are learning this so that we can offer our patients better choices for the things that they're looking to, as you said, ditch and switch. I want to get rid of some of these bad things. What else can I use?
And it's nice to have options.
Yeah.
It's nice to have dōTERRA options where they're clean and that they're safe. and you can put them on not just yourself, but your family and your loved ones. And I can safely recommend them to patients and say, I know that this is not causing any additional toxic load on your body or increased stress, because you're going to get it anyway.
Yeah.
And so why not give yourself the best fighting chance and not add anything additional to that with the things you're putting directly on your skin?
Let's talk about kids for a minute. Children have this really thin skin, a beautiful, beautiful glow to it. They're absorbing a lot, right?
Yeah.
So when we're looking at putting things on our children, is it more important, less important? Where do we put that with children, babies, et cetera, in how much their skin is absorbing?
It's terrifying. You know, you see some of these little ones that come in and their skin is a mess, and you go, okay, well, I know my Western medicine, but I also know some of the effects of it and skin barrier breakdown. And I think it's absolutely critical starting at a young age that you are not, it's cumulative. We know not only UV exposure, but these toxic chemicals. We're finding more and more it's about that long-term exposure. You can start their healthy journey early and it becomes habit and routine. And it's not even a question of what they're choosing to use. But with their immature immune system, with their surface area, and the ability to absorb because of their skin still maturing well into childhood, you have an ability to really control what gets put on their skin and what's getting absorbed, which again can have implications not even later in life. We're seeing some things in elementary school kids, middle school kids that potentially might correlate with developmental issues and hormone issues and precocious puberty and all of those types of things that if we know about it, there's no excuse not to at least do our best. And as parents, we want to, right? You want to do your best for your kids no matter what you're doing. This is a really easy way that you can take care of your kids and put them in a good routine for healthy habits later in life.
Especially with, we have this dōTERRA sun care line, right? And we know that it's not a chemical-based sunscreen and sun care products. It's really a mineral-based. And usually this is a family activity, right? We're taking our kids to the beach, we're taking them to the mountains hiking, we're doing other things in which we would be applying some sun care products. And as we apply, given the choice, our mineral-based sun barriers, sunscreens, we're really helping them out for 10, 20, 30 years down the road, not just at the moment dealing with the issue of the sun, right?
You're exactly right. And in fact, even since I've been in residency, feels like yesterday, but it's been over 10 years ago. They have come out with published studies looking at the sun that you get before 30 really can be one of your biggest factors in developing melanoma later in life and basal cells. And of course, squamous cells is also related to the cumulative sun. But the mineral-based is absolutely key, especially now that we're finding those serum levels, even at not high application rates and seeing those levels in the blood. And we're not sure exactly what the implication is, but I'm not willing to be the guinea pig to find out. And they've also come a long way since when I was a kid. I don't know about you.
Oh yeah.
The bright green or pink. Yeah, it was green or pink, you know, and on any given day. But in general, I feel like the mineral component of the sunscreens and knowing how those function and do protect the skin so much better is worlds away from the chemical sunscreens, which used to really be kind of the only choice we had.
Right. When we were kids, that was really it. Or, you go to the beach looking funny.
Right. Yeah. I think there's an old tennis player that used to, he would play with just like the white nose. And
zinc oxide.
It was almost like the nose was the only place he needed to protect. I'm going, well, okay. But they're making them a lot better. And I can say that with confidence, dōTERRA has nailed it on these sun care products. Not only do they have the mineral sunscreen, but they also have other great benefits with the other ingredients that were intentionally chosen to be put in those.
Well, I appreciate your comment about, as parents, we want to make sure that we're protecting our children from the challenges that they may experience 20 and 30 and 40 years in the future from our decisions now as parents. I think that's really valuable that we recognize how important it is that we prioritize that in our kids. We want the best for them. We want them to grow up and have long, healthy, wonderful lives. And we get those choices as parents early on in those years before they're making those choices for themselves to help protect them, to help
Right.
make sure that they're okay.
And it's not just about the sun. You know, I say I'm obsessed with the sun because I'm a dermatologist,
Sure.
but there's life outside of that. And that includes, as you brought up, the overall wellness.
Yeah.
But it's all connected. And so
Yeah.
you can really start healthy habits now that we're finding out years down the road make a big difference.
Yeah.